The United States is preparing for its worst days ahead with coronavirus cases spiking across the entire country. Hello, I'm Mike Walter, and this is The Heat. The United States topped 10 million COVID-19 cases this week with more than 240,000 deaths. Hospitalizations are at an all-time high with some 60,000 people being treated. Texas is the first state to pass 1 million cases. The situation so grim in El Paso that officials brought in 6 mobile morgues and are requesting 4 more trailers. Beginning Friday, New York will limit private indoor gatherings to 10 people, and it's ordering bars and restaurants to close early. The mayor of New York City says a second wave is imminent. Drug maker Pfizer offered some hope this week, though, announcing its vaccine is 90% effective and could be ready for limited distribution by December. For more on the pandemic in the United States, let's bring in our panel. Here with us in Washington, D.C. is Dr. Kate Dolenko. She's the founder and CEO of Corvus Health. That's a global health firm. Also with us is Joseph Williams. He's a senior news editor with U.S. News and World Report. From Los Angeles, Dr. Gary Richwald is a communicable and infectious disease expert and the chief medical officer with Real Health. And from Boston, Dr. Ali Raja is the executive vice chair in the Department of Emergency Medicine at Massachusetts General Hospital. And why don't we start with you, Dr. Raja? Let's begin there in Boston. What's the situation like at your hospital, and how does it compare with last March and April?
Well, Mike, across the entire country, and especially here in Massachusetts, we're definitely seeing more cases. We're seeing an uptrend. We haven't quite hit our surge yet, but we expect it in the coming weeks. And the reason for that is that, unfortunately, as things get colder, especially here in the Northeast, in New York, and the other northern parts of the country, we're just not able to do the physical outdoor distancing that we've been able to do all summer and fall long. I'm really worried about the coming weeks. And as the mayor of New York said, I think we're going to see an imminent second or third surge.
And Dr. Raja, as you know, we've had so many stories about burnout. This does take a toll on your staff. How are they holding up, and how do you deal with that?
Mike, it's rough. The first time that we did this, back in March and April when we hit our first wave, we all didn't expect it to last nearly as long as it has. It's one thing to deal with a sudden crisis or a disaster. The Boston Marathon, 1 or 2 days after a big winter nor'easter where patients are locked in and can't get out and present with hypothermia. But then things settle back into a normal pace, and you can go out with your friends and decompress. You can go out after work and commiserate about the difficulties of the job. But all of that has been taken away from us. And on top of that, we're all worried about our families at home. So burnout is going through the roof right now.
Dr. Richwald, the way he's describing it, it's the tsunami that just keeps on coming and coming. And I think of, and I want to talk to you about California, but I want to start by talking to you about North Dakota, because I was reading in the Washington Post today, 1 out of 83 people in that state are infected with this virus now. The governor taking the unique step earlier this week, signing an order where if a healthcare worker has the coronavirus, they can come to work even if they're asymptomatic. And I'm thinking that sounds rather dicey and dangerous, but obviously it's a step he has to take. Give me your thoughts on that.
Well, first of all, we should never be put in the position of having to balance the health care, the safety of our first-line healthcare workers and the problem of their own personal health and what they're doing in their job. So I think this is an untenable situation. And although the CDC may technically describe that this is possible, I think this should be the absolutely last choice. And, if this happened here in Los Angeles, we would have to say there was a complete failure of our state government, local government, public health services. So this is the sign of systemic failure in disease control.
And you in California, you're looking at it's edging close to 1 million coronavirus cases, infections reported on the rise in Los Angeles and the Silicon Valley. Give me your sense of why you're seeing that and just how dire it is there.
Well, I think I'm very focused on community-based infections. And what we see is a combination of COVID fatigue and also COVID denial. I think that we haven't seen infectious disease denial at this level since HIV and since the early parts of HIV infection. And of course, the denial is fueled by disinformation, misinformation, and lack of strong public health leadership. You know, as President-elect Biden said, we all need to pull together and look at the common good here. This is a war. It's a war on a virus, and we cannot basically have 5 different generals running this war. That is not going to work, and it's only going to create more denial, more fatigue, et cetera, et cetera.
I spoke to somebody earlier today, Dr. Rich Wald, in London. They're on lockdown. As you look at California, do you suspect there'll be more restrictions?
Well, absolutely. Here in Los Angeles County, we have a doubling compared to October of the number of new infections. So we're roughly going from 800 or 900 to close to 2,000. That is only going to mean that in 2 weeks, 3 weeks, 4 weeks, our ICU rates, instead of being just up 50%, will in fact have doubled. This is going to put a terrific strain on the system. And I think what is important to, there's so much focus on the acute side of this infection. We forget that epidemics, the war on epidemics, is won in the street among average people. And right now, for every person identified here in Los Angeles County, our best estimates is only 1 in 4 of those people is getting contact tracing. Contact tracing is a complete failure in the United States in terms of the levels that we need. And I can tell you from having done a decade of contact tracing in the 1990s and bringing 4 STD epidemics under control. So there is no leadership, there's no training, there's no accountability. When was the last time you saw a statistic on contact tracing? Not even discussed. This is like having no ammunition for your weapons and you're on the front line of the war.
Kate, let me ask you about what he's talking about, because when you break it down, listening to all of you, we've got 3 Ds that we're dealing with. The disease, obviously, but denial, as he mentioned, and disinformation. And all of that's kind of combining. And as he pointed out, some of these steps other countries are taking, they're just not happening here in the United States.
Yes, unfortunately, that's true. And we're hoping that now that, unfortunately, the case is getting so severe in many states, such as North and South Dakota, that governors will start to take steps. Like we've seen that Idaho now, for the first time now, has a mask mandate. So hopefully more governors will follow suit. I think unfortunately we're going down a very dangerous path. Thanksgiving and Christmas will be super spreader events, so it will get even worse. We've seen a quadrupling of cases in nursing homes in the last few weeks and a doubling of deaths. So we know that in Lubbock, Texas, they're now taking care of patients in tents. So it really is a crisis situation. And I agree with the other panelists that it has to be dealt with at a federal level. It has to be coordinated.
And we're seeing 136,000 new cases on Tuesday alone. It's spreading 45 out of the 50 U.S. states now dealing with an increase in cases. Talk to us about the missteps that got us here, and are there steps that can be taken to reverse things?
Right there, I would say basically 4 sort of areas of missteps. One is on masking, that the current administration did not promote universal masking, in fact, undermined it. So that's one of the big challenges. Another challenge was around testing. The fact that we didn't test as much as we could, and in fact, testing was discouraged. We know that testing actually helps. Testing does not drive up the numbers of cases. And then there were errors around federal coordination and cooperation. The fact that the federal government did not procure masks or other supplies on behalf of the states. In fact, even now, when you look at the central federal stockpile, there are only 115 million N95 masks, and the government had wanted to have 300 million by this time of the year. And so we're going to have a shortage there. And then the fourth area of concern was that of international cooperation, that the U.S. has withdrawn from the WHO and not cooperated with their studies and their work.
Joseph, let me ask you about former Vice President Joseph Biden. I spoke to you this weekend. He's the projected winner of the presidential race. He's already out talking about this, putting a task force together, and he's also talking about masks. Let's listen.
I implore you, wear a mask. Do it for yourself. Do it for your neighbor. A mask is not a political statement, but it is a good way to start pulling the country together. I want to be very clear. The goal of mask wearing is not to make your life less comfortable. It's to take something away from you. It's to give something back to all of us, a normal life. The goal is to get back to normal.
Joseph, we know that about 75 million people voted for Joe Biden, but about 70 million voted for Donald Trump. I'm not saying all 70 million aren't wearing masks, but some of them are not. We've seen it at all these rallies. How does he get that message across to get everybody to buy in on this?
The buy-in is going to happen when the message gets repeated often and over and over and over again. But there are two things that seem to be in President-elect Biden's way. The first is his title, President-elect. He's not the President of the United States. He has not been sworn into office. And as a matter of fact, there are still people who dispute whether or not he should be allowed to take office. That's problem number one. Hurdle number two is the fact that President Donald Trump is in office, and he has made no effort at all, not since the election and even barely before the election, to communicate that message. As a matter of fact, you talked about undermining it earlier. So effectively, what one of your guests said is that you can't fight a war with more than one general, but that's precisely what we have here. One general who is not interested at all in prosecuting this battle and thinks that time will take care of things. The other who is very much engaged in battle, but doesn't have the authority. He has the moral authority, but not the mantle of the presidency to drive that message home and get people to take it seriously. So until one of those two things happen, either until we have a transition of power or until Biden repeats the message often enough and gets taken seriously often enough by most of the country that we get people to buy in voluntarily, we are still going to be in this difficult situation.
Talk to me about this new task force. What are we learning about Biden by his selection of these folks on this task force?
Well, basically, the task force indicates that he's taking very seriously his vow on the campaign trail to follow the science. We've got former surgeon generals on there. We've got prime epidemiologists, some of the most esteemed epidemiologists in the country. And I would suspect that as soon as President-elect Biden takes office, if that happens in the near future, we'll probably see a return of Dr. Fauci to the main stage to try to help coordinate the efforts here. But clearly he's communicating the message that science is important, that following the science is even more important, and that people should be able to listen to experts without any degree of political interference. That's the main message that he's trying to send here through his actions and not necessarily just his words.
And Joseph, you were mentioning how the president has been largely absent. The task force, we haven't seen them really at all. Leadership really matters on an issue like this. And as you said, you've got a couple of generals speaking at the same time. With this leadership vacuum and with Biden not going to be taking the oath of office until mid-January, how serious can this snowball?
Wow, I hate to even posit that question. The mere fact that we're considering that question is really dramatic and really says a lot about where we are in this pandemic. Some estimates have been said as many as 2,000 cases per day, 2,000 fatalities per day, reaching 300,000 fatalities by the end of the year and certainly by the middle of the winter. And we've talked about it before, that the flu is coming on. We've got people staying indoors. We've got people resistant to not having large gatherings, restlessness. It could get much, much worse than it is right now before it gets better, and it almost certainly will.
And Dr. Richwald, earlier this week, the U.S. Centers for Disease Control came out talking about masks and how effective it is in not only preventing the disease for those wearing the mask, but those around it. Talk to us about the strength of wearing a mask and how much of a difference it could make.
Well, it makes an enormous difference. I'm the chief medical officer for a company called Real Health, which is the largest provider of COVID-19 prevention to the film, TV, and streaming industry. And in that setting, we are able to mask enough people so that those individuals like ourselves who are on set without masks, in filming it's sometimes at less than 6 feet, masks make the ability to actually produce entertainment in the United States. So this is not just a theoretical issue, this is a very practical issue. And I just also want to say that the fact that we're talking about masks 9 months into this pandemic means we have lost this war. This is not an intellectual knowledge deficiency problem. This is not the minds, this is the hearts. And the current president, who I admire, the future president, who I admire greatly, is going to have to get to people's hearts in the way that he is empathetic, but also tell them how dangerous the situation is, how many people are going to die. The most effective TV on this is when PBS nightly news in the United States shows 8 or 9 vignettes on Friday of people who have died. That makes the difference. That made the difference in HIV. We need to stop worrying about the intellectual issues here, assume they're going to be taken care of, and get to where people are in their hearts and souls about this, that we are one country, one group, and we're going to have to pull together, or this is going to be an ongoing economic disaster as well as medical disaster.
Dr. Raja, on that point, one of the things that I think about with this, and I want to get your thoughts on it, is initially we see it in New York, or we see it in Washington State, or we see it in New York, and then it just kind of spreads. Maybe it's in New Orleans. But a lot of people around the country, it's not in their neighborhood. They don't see it up close. But now in El Paso, I mean, it's really up close. I was listening to a reporter saying, you know, I heard ambulance after ambulance after ambulance. She was standing outside a hospital describing what she's seeing, and funeral directors talking about how they're just loaded with bodies, and that the family members are coming in and saying that they're terrified that they're going to be next. How can we convey that message so that people who are in areas where that's not happening know what's coming?
Mike, for better or for worse, it's actually happening everywhere now. There are some areas where it's not happening, but there is not a state, as was mentioned earlier, there is not, except for a handful of states that aren't seeing cases rise week after week, month after month. What used to be isolated to the large cities is now happening in small towns. You mentioned El Paso, which is not a small town at all, but I'm from a small town outside of Houston, and there are small towns throughout the entire state of Texas that are being just as affected, and in some cases more affected. Small hospitals in some of these rural communities have very few critical care beds, and very few beds at all. And so we're starting to see people who know personally affected patients. The problem, as one of the other guests commented earlier, is that we also have a lot of disinformation coming out, and we're having to argue about the validity of the medical information that's being given by physicians, by nurses, by infectious disease specialists, epidemiologists, folks who are seeing patients on a daily basis. And when their expertise based on years and years of experience is being questioned, again, as was mentioned, we shouldn't be trying to argue about the intellectualism of all this. We really need to be winning people's minds, or winning people's hearts. And that's such a harder battle to fight, because even when the evidence is in front of you, when the cases are rising, when nurses and doctors in your community are telling you this is affecting us right now, if people aren't willing to listen, then we need a different tactic.
So, Kate, what is the answer? What is the tactic, do you think?
Well, I agree with them that we do need to make the emotional arguments, but I think there's a certain group of Americans that are more persuaded by economic arguments, and we can make very strong arguments there. For example, currently 60,000 Americans are hospitalized with COVID right now. At an average hospital cost of $30,000, that's close to $2 billion just for the people currently hospitalized. And so you can imagine, as this is going to get worse, through November and through December and January, this is probably going to reach $1 trillion bill just for the hospital care. So I'm hoping that we can persuade people with these type of economic arguments, because a lot of folks who live in rural areas, they're not going to see the ambulances. They're not going to know anyone who's affected until it's too late. So we need to make different types of arguments to reach different folks.
Dr. Richwell, I saw you shaking your head. You think that's the answer?
I think that's part of the answer. You know, we're taught, when I teach public health, we're taught that fear is only a short-term, changes people's behavior on the short-term basis. There has been a complete absence of communicating fear in this situation. We forget quickly what New York City was like in March and April with those, as you said, those ambulances, the cavernous city essentially evacuated by people who could get out of Manhattan and get to the suburbs and their summer houses. But, you know, we need to tell the truth. I think what President Trump said about not worrying Americans is just what the problem is. He was doing the exact opposite of what was necessary at the time. He did not worry us. He did not trust us. He put doctors in an impossible position. And, you know, you don't get paid enough to be a doctor to be put in the kind of position that President Trump has put most of us who are on this panel tonight in. And we should not be having to fight for the truth. We should be having to fight this virus. There's a big difference.
Kate, in response to fighting the virus, there was some good news this week from Pfizer that they've got a vaccine candidate that looks very, very good. In fact, Dr. Anthony Fauci had this to say about it. Let's listen.
As a vaccine, it's more than 90% effective, which is extraordinary and will play a major role in what the outcome of this is going to be. Help is on the way with a vaccine. We need to hang on. We know there's light at the end of the tunnel, but that doesn't mean that we're going to give up the important public health measures that we continually still have to do every single day.
Kate, tell us about the vaccine and the timeline for its rollout.
Yes, so Pfizer's vaccine is an mRNA vaccine. And remember, there's never been a vaccine approved before using mRNA. And so what needs to happen next is Pfizer is going to provide their data to FDA and to other regulators in Europe and elsewhere so they can examine the data themselves and make a decision about whether or not it's going to be approved. And then once it's approved, Pfizer will start producing tens of millions of doses. And there's been, you know, some argument over some of the statements that have come out of the new task force, the new COVID task force that that President-elect Biden has put out about whether the U.S. should share the vaccine or not. But I think it's a moot point, because the truth is half of Americans have already said they won't accept the vaccine. And even if all Americans wanted the vaccine, we don't have the logistics to roll it out fast enough. So producing vaccine and sharing it with other countries really is not going to delay the rollout in the U.S.
And Dr. Raja, on the issue of logistics, I mean, this is a vaccine that has to be extremely cold. I was looking minus 70 degrees Celsius is how it has to be stored. It's going to be 2 shots. From a logistics standpoint, just take your hospital, for example. How difficult is this going to be to kind of administrate this?
Mike, it's a great point. The logistics of this are going to be very hard. I run the emergency department of one of the largest hospitals in the country. And even thinking about how we're going to administer it, not just to our patients, but to our staff, is it's not a logistical nightmare. We've got teams working on it, but it's taking weeks of planning, months of planning. Move on from that to administering it to our patients, who we own, the primary care patients that we're responsible for. Moving on beyond that, we want to be one of the sites that folks who don't have routine care, who are homeless, who are in nursing homes, can come for their vaccinations as well. And setting that infrastructure up is also going to be complex. But the one thing that I think we all need to remember is we actually don't know how long the immunity with this virus is going to last. For example, we're all very used to getting flu shots every year, and that's because of the fact that the antibodies created by the flu shot last for most, if not all, of the flu season. Well, That's why we get it once a year. With this, if the immunity lasts 2 months, 4 months, 6 months, that's going to affect just how often we need to give out potentially a vaccine like this. And so it may not be a once a year thing. We may end up needing to give repeat doses as well.
Dr. Richwald, an infectious disease expert from Emory University, Dr. Carlos Del Rio, said this: with 1,000 deaths per day, it's like 2 jumbo jets falling from the sky. I think of 9/11 and how America was impacted, and yet it doesn't seem like it's going over that way now. Thanksgiving just around the corner. You know, even with all the warnings coming from all of you, that people are going to have family members come in. They're going to have these basically super spreader events. Talk to me about your concerns as we move forward through the month of November.
Well, I have 2 concerns. The first I'm going to bring up is the issue of influenza vaccine. The single most cost-effective and easiest thing to do about this pandemic is to make sure everyone has received an immunization for the flu. The problem with overlapping symptoms between the flu, common cold, and COVID-19 infection is a gigantic problem. I watch the news all the time. I haven't even heard anybody say anything about this. We have one testing company, Curative here in LA, that is starting to give flu shots when you come for your COVID-19 test. Now that's smart thinking. And that's the kind of thinking that if we don't start doing quickly, since the flu season is almost on us, we are going to be up a river without a paddle in our canoe, and it's going to be leaking fast. So, you know, I'm astounded that they could appoint 12 smart people, and influenza was never mentioned anywhere in our major papers in the United States. The other problem is, you're absolutely right. We know from looking at controlled environments like the film set, when do people get infected? When they go to the 40th birthday party with 12 people, all socially distanced. What happens? They take their mask off to eat and drink, they get infected. They go to their parents' 40th anniversary, take their mask off, drink, get infected. There is very little attention paid to this. I'm really glad you brought it up, and you know, we'll see. I think our other panelists are acutely aware that if we don't do something soon and put out the right social messages, you know, we're just going to be in a horrible situation.
Well, we're going to have to leave it there. Thank you all. It's been an enlightening conversation, although somewhat scary as well, but we'll keep our fingers crossed that we're moving in the right direction. That's it for this edition of The Heat. I'm Mike Walter in Washington, D.C. Thanks so much for watching.
Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict or US politics, The Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find The Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe. Thanks.